Hello, and welcome to the series of our guideline videos for healthcare professionals. In this video, we are going to discuss various queries regarding OMSB Medical Licensing Exam, for different healthcare professionals, their step-by-step guidelines for Dataflow PSV, scheduling Prometric exam, and details regarding Viva or oral exam. These queries are: what is OMSB exam? What are the general requirements for healthcare professionals? Should I take Prometric exam, or apply for Dataflow first? How to complete Dataflow PSV for OMSB? Step-by-step guideline. Can I apply for OMSB license without securing a job? How to schedule Prometric exam? When Prometric result is announced? How to cancel or reschedule exam? How long is the exam? What is the exam cost? How Viva is conducted? What is the jobbing condition for healthcare professionals in Oman? This is Dr. Mohammed from Interface Medical Education, and I will try to answer all these queries in detail. So, keep watching this video till the end. I am sure that you will be able to understand many aspects related to OMSB Medical Licensing Exam, and its Dataflow process. Before starting this video, we would also like to invite you to watch many of our videos, made for healthcare professionals. I will request you guys to subscribe to our channel, hit the bell icon, to enjoy more of such informative videos in future, and of course, if you like this video then, do not hesitate to hit the like button and send us your valuable comments. OMSB, which stands for Oman Medical Specialty Board, is a governing body, which regulates and maintains best quality standards in healthcare-related practices throughout Sultanate of Oman. All healthcare professionals, who are willing to practice in Oman, are required to pass OMSB Medical Licensing Exam, unless declared exempted by Ministry of Health. This written exam is administered by Prometric test centers worldwide, followed by an oral, or Viva exam, by Ministry of Health in Oman. Healthcare professionals are required to pass these two exams, written and oral, unless declared exempted by the Ministry of Health. Generally, all healthcare professionals are required to have certain number of documents, as well as meet some general eligibility requirements. Like, a candidate should have clear scanned copies of following documents: original degree or certificate or diploma, from a recognized institution. If you are from India, Pakistan, Egypt or Afghanistan, then you must also provide clear scanned copy of backside of your degree, marksheets or transcripts of the qualification, internship or house job certificate, for doctors only, experience certificate for general practitioner or general dentist. To be eligible, one must have at least 5 years clinical experience, post 1 year house job. Whereas, for specialists, one must have at least 3 years experience. For nurses with bachelor degree, candidate is required to have minimum 2 years experience, and nurses with diploma need minimum 3 years experience. For pharmacists, with B.Pharm, or D.Pharm certificate, candidate is required to have 3 years experience. For technicians, and other allied healthcare staff, with valid diploma, candidate is required to have 3 years experience. This experience certificate should be duly signed, and stamped. Should have clear email, and other contact details mentioned at their letterhead. Must be issued by Human Resource, or Administration Department only. In case of self-employment, please make sure to submit your business registration certificate. Valid medical license issued by licensing authority of graduating country. Recent good standing certificate, GSC, issued by the medical council or association from the country of last employment. This certificate is only valid for 6 months from date of issue. Passport size photographs in blue background, and some with white background. Photocopy of the national ID card. Your CV, in the required OMSB format, as explained in application and interview guide. We have provided the link of this important guide, in description section below. Your valid passport. Make sure that it is not expiring within at least 6 to 8 months, from the time of starting this process. And lastly, log files, for specialists only. Although, some may argue that one should start Dataflow process only after successfully clearing OMSB Prometric exam, because it may save Dataflow fee, in case if one could not pass exam. In fact, you can opt for either process, as neither is a requirement of the other. It depends upon you, that which process you take up first. Dataflow has recently introduced new application system for Oman Medical Specialty Board, OMSB. Previously it was this website, where an applicant was required to start application process, for Dataflow Primary Source Verification, PSV, but currently, applicant is required to start PSV process through visiting following website. If it is your first visit, then sign up through entering your valid email address. Agree the terms and conditions, and confirm to proceed. You will receive account activation link at your email. Click at the link. Create a new password, and confirm it. Now you are ready to log in. Enter your email, and enter your password on the next screen. Once you are inside your dashboard, you can start new application from here, or can check status of your existing application. This scale defines your application status. You can change the language from here. Now let's start your new Dataflow application. On this licensing details page, please select authority name, which is in our case Oman Medical Specialty Board, OMSB. You can see different health authorities' names here, so be careful while selecting authority name. While selecting case type, make sure you understand the terms. New means that you are applying for the first time under OMSB. Renew means that you were previously licensed by OMSB, and need to submit new documents for verification. Report reissuance means that you are interested to reissue your previous Dataflow report. Let's select new option here. While selecting package type, make sure you understand the terms. Custom means that any specific new document required to be verified, as per OMSB's classification. Let it be education, employment or license document. Package includes the verification of 1 educational qualification, that could be diploma, or bachelor, or master's, or other degree. 1 health or medical license, and last 3 to 5 years experience or employment certificate, which could be up to 3 certificates. This package type will give you the option to submit additional documents for verification, if required. Let's select package option here. While selecting service type, you may select regular service, where your PSV report may take 25 to 30 working days. You can also take other value-added services for application processing against service charges. You can find more details here. Select your profession from available options. Let's assume that you are a physician and willing to apply as general practitioner. Don't worry. The steps are almost similar for other healthcare professionals. For package details, review the selected package details. Click Confirm to proceed with the application process. If you have more than 1 education degree, or health license, or employment certificates to verify, then simply click this Add button. Please note that an additional cost will be applied to your application if you have more than 1 education degree, or more than 1 health license, or over 3 employment certificates to verify. Select facility name of your employer from the list. If you don't have an employer in Oman yet, then select this option. If your employer health facility name is not available in this list, then click Other Facility option, and insert your facility details manually. Click Next to proceed. You may change the Dataflow service plan from here, or continue with the existing service. Review the following information, and click Add OK button. On Personal Details page, upload your clear scanned passport copy. If failed after trying again, then manually provide your correct passport information, and submit. Provide your correct mobile number to receive OTP code. Once received, validate the received code like this, then click Next to proceed. On Verification Details page, start filling your health license details. Fill out all required information with correct details. While clicking at License Issuing Authority Name field, it contains pre-populated data which may contain the name of your licensing issuing authority. If you cannot find your issuing authority, then you can click at the link I cannot find my issuing authority from the list, and provide details manually. Otherwise select the name, and accept the terms through clicking here, and click Add Submit button. Fill out all required details marked with red asterisk on this page. Upload the required license. Click at Next button to continue. On Employment page, while clicking at Name of Employer field, it contains pre-populated data which may contain the name of your employer. If you cannot find your employing facility name in this list, then you can click at the link I cannot find my issuing authority from the list, and provide details manually. Otherwise select the name, and accept the terms through clicking here, and click Add Submit button. Fill out rest of the required information. Upload the required experience certificate. For multiple employment verification, repeat the same process. On Education section page, please provide correct information. While clicking at Degree Issuing Authority Name field, it contains pre-populated data which may contain the name of your issuing authority. If you cannot find your issuing authority name in this list, then you can click at the link I cannot find my issuing authority from the list, then provide details manually. Otherwise select the name, and accept the terms through clicking here, and click Add Submit button. Fill out rest of the required information. Upload the required educational document. And click at Next button. In Letter of Authorization section, consent it to digitally sign this letter. You can also download it for your record. Click on Finish button. Upload your CV, which you may have already created, as explained in the initial part of this video. Click at Next button to end this application process, and now you can review your provided information. For any required changes, you may click at this edit link. Once satisfied after reviewing provided information, you can download this entire application for future reference from here. Click Add Submit Application button to continue. On Payment page, select Payment Method, and then click Submit Application button. When your payment is successfully completed, then Dataflow will send you a payment receipt at your email address. Once your Dataflow PSV report is verified, within specified amount of time, if having no discrepancy, then Dataflow Group will make this report available to OMSB. And, you will also receive a Dataflow reference number at your email address. Yes, you can. In fact, employers in Oman prefer candidates who have applied for exam and done all paperwork till Viva by themselves. A candidate can schedule OMSB Prometric exam without using any eligibility ID or uploading any required document. After ensuring that you fulfill the general requirements for healthcare professionals, as we discussed earlier in detail in this video, simply visit to Prometric website. Click Schedule My Test. Search for OMSB Exam. Click at Oman Medical Specialty Board, OMSB. Under Actions tab, click Add Schedule link. Review registration requirements, and click Next. Review Prometric policy notice, confirm and consent it, and click Next. If you have already been provided eligibility ID by your sponsor, then click Yes, and provide required information. Otherwise, you can schedule your exam without eligibility ID. For this, select No option. Select your specialty from the list. Let's select General Practice here. Don't worry, the process will remain almost the same for other healthcare professionals. Type the name of city where you wish to take this Prometric exam. Choose your preferred start and end date. The end date calendar will show you only 15 days appointment slots from the start date. Click Next after choosing appropriate dates. Among available results, select your desired available test center date and time, and click Next. Review, consent Prometric biometric policy, and click Next. Complete your profile information as per your passport. Verify the information, and complete the appointment through making payment. Once you have successfully registered, an email from Prometric will be sent to you with confirmation letter. For details regarding how to prepare yourself the night before exam, and what to bring at the Prometric Center, kindly watch our DHA Prometric exam scheduling video, especially the timeline starting from 8/28 onward. We have provided the link here, as well as in the description. The result is given in the form of score report, right after the exam. This score report contains the breakup of marks obtained in each section. Make sure not to lose this report, as there is no possibility of reissuing another score report. However, you may request for a certification letter not more than 1 month from the day of the exam, and a fee will be applied on it. For rescheduling and cancellation of exam, candidate need to contact or visit Prometric Center at least 5 days before your scheduled appointment. $40 is charged for rescheduling. On the test day, don't forget to bring your valid passport. If it does not have your signature on it, then bring a secondary form of ID, which presents your clear signature. You should also carry Prometric confirmation letter as well. You can take the exam up to 3 times per 1 calendar year. Depending upon the exam categories of physicians, dentists, nurses, midwives, and allied healthcare professionals, and their wide range specialities, the Prometric exam duration is from 2 to 3 hours, containing 70 to 150 MCQs. Depending upon the exam categories of physicians, dentists, nurses, midwives, and allied healthcare professionals, and their wide range specialities, the Prometric exam cost ranges from $170 to $250. Once you have successfully passed Prometric exam, then you need to pass the Viva or oral exam, which is mandatory for all specialities. There are a couple of main points you should know before appearing for this Viva process, like: if your score is 60 to 70% in Prometric exam, then you will get 2 attempts to clear Viva. However, if your Prometric exam score is above 70%, then you will get 3 attempts to clear Viva. International medical graduates, IMGs, can now take this Viva through personally visiting OMSB interview facility in Muscat, Oman. Few months back, it was conducted online via Zoom, due to COVID restrictions. A visit visa will be offered after successfully clearing Prometric exam. Candidate need to provide positive Dataflow certificate, Prometric exam certificate with passing result, passport size photograph, clear scanned passport copy, and payment receipt for Viva. 2 to 3 doctors panel are there to interview you. They usually ask about different case scenarios, treatment, drugs, doses, advices, side effect of the drug. Sometimes, they might start the Viva with the recent cases you have managed yourself. One of the examiners can be pharmacist, and in such case, you should expect questions related to drugs dosage and side effects. For GPs, you may be asked 3 to 4 questions. 1 or 2 from general medicine, 1 or 2 from obs and gynecology, and pediatrics. For specialist, you may have 2 to 3 case scenarios specific to that particular specialty. While taking history, you need to ask related questions to the examiner. They will answer you accordingly. Try to look calm and composed, do not move your hands unnecessary, and keep good eye contact, and take history with confidence. They don't want to see you shaky during this process. Be very much prepared in your emergency management. They don't want you to make any mistake in managing emergency case. For detailed guidelines regarding OMSB interview tips, you may visit OMSB Application and Interview Guide. We have provided the link of this important guide in description section below. You can also watch our detailed guideline video, made specifically for interview, for healthcare professionals. We have provided link here, as well as in the description section. Like other Arab nations in the Gulf, who mostly relied over expats to provide manpower in different sectors, including healthcare, seeing increasing drive to facilitate and replace locals in different sectors. Omanization, in public and private healthcare sector, is leading to a lack of job security for overseas healthcare professionals. Ultimately, this has caused salary packages decline. Overseas general practitioners, who used to have good starting offer from 900 to 1500 Omani Riyals, now usually end up with 600 to 1000 Omani Riyals, plus, often with a condition to work in remote areas, having typical desert climate. Despite Omanization drive, there are still plenty of opportunities still available for overseas healthcare professionals, as Oman will require 13,000 additional doctors by 2040. Similarly, other healthcare professionals will also be needed to overcome this demand. That's all from us. Hopefully this video will be beneficial for you, and will clarify many of your questions related to OMSB exam, Dataflow process, its Prometric scheduling, and Viva, or oral exam. Do not forget to watch many of our videos made for healthcare professionals. Hopefully, you may have liked this video, then, do not forget to hit the like button, share, comment, and subscribe to our channel. Have a good day, bye.